we're moving to the clinical examination or the examination. This is gynae4u.com. I am Mr. Bedoya Ronga. Usually, the examination will happen in the presence of a chaperone. The chaperone is the patient advocate. They will be looking after you. They will let us know if you are in discomfort while we're doing the examination. The examination will commonly happen in a couch. You will be lying on your back or on your side, sometimes both. For the gynecological examination, we will need you to be undressed from the waist down. You will not need to remove your top, but we will want to examine your tummy too. You will be given privacy to undress. Once you're undressed without underwear on the couch, we will start checking your tummy, looking for any swellings, any abnormalities in the skin, any visible lumps. We will gently touch the abdomen, trying to find any abnormalities, tenderness, painful areas. Then we will move to the examination down below. For the examination down below, we will ask you to put the legs in the froggy position. This will allow us to see your external genitalia and your perineum. Commonly, a speculum examination is performed with the use of lubricants. The speculum used in this position, it's called cuscus. It has two mobile parts that once inserted opens up inside, allowing us to see the neck of the womb. This part can be uncomfortable, so it's very important you try to leave these muscles relaxed. And if it's too painful, to let us know. Once we visualize the cervix, we check for any abnormalities in the neck of the womb. We may take a smear test if they are overdue. We may take swabs to rule out infections. Sometimes we may pass a tiny tube inside the womb to take a sample of the lining of the womb. This is called pipelle endometrial biopsy. Before or after the removal of the speculum, we will conduct an internal examination. This is done with 1 or 2 fingers inside the vagina. There are different objectives. When the fingers goes around the neck of the womb and the sides of the cervix, we will be looking for the size of the uterus, any pelvic masses, any abnormalities around the cervix, any tenderness during movement of the cervix. We can also look for nodules in the vagina, uterosacrum ligaments, and we do this by running our fingers through the vaginal walls, looking for those tender areas or little nodules. Sometimes we do systematic pelvic floor examination. We do this running our finger clockwise or anti-clockwise through the pelvic floor muscles. We will be looking for specific areas of tenderness. We call those trigger points. For patients who are coming with complaints of prolapse symptoms or incontinence symptoms, it's very useful to assess the strength of your pelvic floor muscles. For that, keeping 2 fingers inside of the vagina, we will ask you to squeeze and hold up to 8 seconds. In that way, we can ascertain the strength of the muscles and how long they can hold the contraction. Also, for prolapse examination and incontinence, it is common to ask you to cough or to bear down for a few seconds to assess for them. Prolapse very commonly is assessed on your side with a different speculum. This one is U-shaped and it's called Sims speculum. And you will be asked to cough or bear down while we move in this speculum to assess for the prolapse. This concludes the examination. You will be given privacy to dress. After the examination has been concluded, your gynecologist will discuss with you the findings. Also, any further testing that is required, and will agree with you a plan of management. That plan of management should have clear instructions for you of what to do. If you need to take tablets, attend for extra tests, all that should be spelled out so there are no confusions. It should also contain clear instructions for your GP, so your GP knows what is expected from them. At the end of the consultation, it should be the agreement whether a follow-up is required or you are happy to be discharged back to the GP care with the agreed plan of management. I hope this has been useful for you. Please post your comments. Thank you.